hit in terms of losing job, educational opportunities, and even their life. So 61 countries around the world have more than 30% of their urban population living in slum. So living conditions are dramatically affecting the health profiles of the urban poor. So with the pandemic further expanding its reach, every day is now more difficult and more uncertain for these people. So people in informal settlements are more vulnerable due to malnutrition, lower life expectancy, chronic respiratory diseases, and tuberculosis and HIV and AIDS. They have a higher exposure to other diseases associated with weaker hygiene practices, exposure to waste and wastewater, and changing weather conditions and other risks. So the bottom 20% of the poorest urban population living in an informal settlements have a life expectancy that is 15 years shorter than the richer 40% of the urban population. So the COVID-19 pandemic gives visibility to the multiple inequalities, vulnerabilities, form of exclusion and deprivations caused by decades of neglect and underinvestment. People living in informality are invisible. They are not counted in data collection and monitoring, planning, and social services. UN Habitat is working closely with local government in developing countries to offer practical solutions to help cities cope with COVID-19, including scale up rapidly affordable provision of water and sanitation, issue moratoriums on water and electricity charges in partnership with service providers. Third, arrange emergency cash grant and transfer and ensure emergency access to food and water. Fourth is cease all evictions, particularly in cases where individuals cannot pay their rent and have nowhere to go. And fifth, develop distribution networks for food, water, and other essential. The sixth, develop strategies for physical distancing in public transport or when queuing for water and food distribution. Seven, decentralize larger main market into micro markets. Number 8, encourage urban agriculture. Number 9, identify existing facilities and could be repurposed or provide temporary low-cost structure as community care facilities. And then establish safe protocol for funerals. Local governments can take the lead to work with communities in informal settlements and all stakeholders to implement preemptive strategies based on area-based risk assessments of residential area. Number 2, ensure worker safety for government workers and all those ensuring basic services. Provide clear information and advice in local languages about COVID-19 and consult community leaders and civil society organizations and ensure their support to replicate successful effort. So let us not focus on what has not been done, but instead turn to what we need to do to ensure that we lay the groundwork for integrated and inclusive citywide responses and recovery. So my friends, 2020 started the decade of action on the implementation of the SDGs. COVID-19 is very unexpected, unplanned global wake-up call for this decade of action. We cannot move beyond the outbreak if people living in informality remain at risk because of insecure tenure and overcrowding, and lack of water and sanitation, and lack of income security and access to social services. So on Monday, the United Nations released its full for after the outbreak, highlighting that we will be no return to the old normal and calling governments to act to create a new economy and more jobs. The UN's immediate socio-economic response to COVID-19 sets out 5 pathways to set in motion a safe recovery of societies and economies. The target is a world that is better than the old normal, more sustainable, more gender equal, and more carbon neutral. One of the 5 pathways is to promote social cohesion and to invest in community-led resilience. This is where local government needs to come out in the forefront for the benefit of people living in informal settlement, working with the informal sector. UN Habitat is working with you to invest in resilience. Every week, twice a week since 25th March, I joined this learning session to ensure that UN Habitat action address the needs. I hear from you. I call on the UN Habitat's country managers to start immediate assistance project in all regions. Last week, I launched the United Nations Habitat or UN Habitat COVID-19 response plan. Ongoing programs are being repurposed, such as the participatory slum upgrading program, which reaches 5 million slum dwellers in 190 cities in 4 key countries. So as the start of this session, allow me to thank once more the thousands of participants who have joined this learning event. I would like to thank UCLG, Emilia, the UCLG members, Metropolis, and the many speakers. With all of you, my support is for local governments who leave no one and no place behind, whether formal or informal. So together, we must overcome COVID-19 and reshape our cities and communities beyond the outbreak. Thank you very much to all of you, and I hope that everybody will stay safe, stay healthy, and be with the high spirit. Thank you very much, Emilia. Over to you.